The great benefit of the system which we can use is that it's a modular system. So you have your classical 2D HD camera system, and in case you think it's benefit of the patient or for the local situation, you can just switch to 3D, and if it's fine, you have the benefit. If not, you go back and you come back to the 2D. And about the question if we have real benefit for the patient, we are just running a multi-center trial on this topic with 4 centers. We can't talk about the final results because we haven't finished yet. But I think it's a promising technology, and we are looking forward to present the data, maybe next year, mid of next year.
Can you give us a little hint about expected benefits for patients?
It's even the same benefit like 2D, but I think it's superior. And when we talk about precision medicine, we talk as well about precision surgery. And this is in main focus because we can use navigation, we can use K4 monitors, we can use even 3D imaging. So this all will lead to better surgical treatment. So this is our feeling, our not final results, but maybe it's in this direction.
Dr. Hellings, what do you think are the expected benefits for patients?
Well, the expected benefits still need to be properly shown in a study, but it makes sense that if you have a better estimation of the endonasal anatomy, that at the end this will also lead to less risk of complications, as has been already highlighted by Professor Castelnuovo. And on top of that, I would like to add here as well that it may be recommended for routine use as well, because there is some learning curve as well. When you start working with the 3D Vitum technology, then the first case you feel a little bit uncomfortable because the view is different. But I must tell that I have been impressed by the high quality of the images, and this was not only leading to a joyful surgery in my hands, but also the residents and the fellows, they enjoyed it very much because they could appreciate the anatomy much better than they used to enjoy while looking at the two-dimensional screen. So there are several benefits to be expected.
Dr. Constantinidis?
I agree with Peter that the advantage and the benefit for our patients is the precision of our work. And there is also a study from the Fraunhofer Institute in Munich. They have compared 2 groups of surgeons. One group has used the 2D and one group the 3D system. And they made stitches in an abdominal model. And they found clearly that the surgeons that used the 3D images and the 3D technology, they were more precise in the work. The surgery is done shorter in a shorter time. And this is the benefit for our patients. That means it's more minimal invasive, it's less damage, less trauma, less complication, as Peter said. And that means also a faster recovery time for our patients.
Dr. Prokopakis?
I think that from my point of view, we're talking about 2 different things, 2 different approaches. Working and operating on a 2-dimensional plan is different than 3D. In terms of what it was stated before, our brain does the 3D work while we are moving the scope into the nose. This is the reason people that are not familiar with the 2-dimensional images, they cannot follow the operating procedures, even the young individuals that they are the young trainees. While using the 3D technology, the 3D scopes, and especially the new devices, simply you have to hold the scope just in the entrance of the nasal cavity and then working with the other hand, but the left hand or the right hand must be steady, at least to my knowledge. So we're talking about 2 different modes, and I truly believe that one who will decide to work with 3D systems, he has to keep on working with 3D, otherwise that would be not so prudent for his daily practice. And I agree with Professor Hellings that for younger individuals that would be easier than older physicians. Now, if the question is whether or not the patient would benefit from these devices, I really have no clue, but we do have a 3D experience, some of us, using the microscope. and I don't think that there were any differences in regards with patients' benefit. Of course, as time passed and technology transfers to new clinical tools, all these issues must be readdressed again, and criteria for their use must be written down.
Mm-hmm. Dr. Carrie?
I think there's some interesting points around what one can't measure here. Certainly within the nose, when you're operating within the nose or the sinuses, you generally have a margin of error, which you can get away with in 2D endoscopy. But when it comes to operating in the skull base, doing transcranial procedures, actually every potential maneuver is life-threatening, and that added dimension of view in 3D that you have with this facility, I think makes the operation safer, and therefore I think will encourage surgeons to push the boundaries further in the knowledge that they can see and visualize better.
Dr. Molteni, what are the benefits for you if you're working with this technology?
Yeah, I agree that the great benefit is when working in open field, especially in anterior skull base, and you clearly see the deepest of the structure, and you see very well the anatomy. So again, I think it's important to underline that the main issues is not 3D, because we all see 3D every day while living and working. So the issue is the view. If the view is clear, the color are good, and the light is good even in with some blood in the field. So that's the point, because 3D is of course helpful for all of us.
Dr. Hellings, your experiences?
Well, the 3D technology fits fully in the emerging field of rhinology, where the 3D technology is becoming part of routine practice. Nowadays, in the university hospitals in Leuven, we apply three-dimensional morphing, explaining the patients what is the expected outcome of surgery. We apply even 3D printing in order to promise patients to some extent what is actually the expected outcome of no surgery, and this mainly applies to rhinoplasty, not so much sinus surgery, but rhinoplasty. And I do think 3D technology in the field of sinus surgery will be the future as well. So I think this fully fits with the concept of novel trends in rhinology, and where rhinology surgery should go to in the future.